kind of continue a little bit where we were at yesterday and bring up discussion on House Bill 2556. What's the committee's wishes? Representative Reese.
Are you asking for debate?
Debate, motions, whatever. Representative Reese.
Madam Chair, I'd like to make a motion to pass the bill with no recommendation.
Is there a second?
I'll second.
Seconded by Representative Orpeza. Discussion and comment on the bill. No discussion and comments? Representative Vaughn.
I like to talk. I'm happy to kick us off. Yeah, I mean, I did print out, and I have here all of the proponent testimony that was written that we did not hear yesterday in committee. And I think not only does this represent the opinions of many of my constituents and healthcare providers in my community and communities across the state, but we also heard from diverse groups of people yesterday, including healthcare providers, those who have worked in states with Medicaid expansion, those who have worked in our state without Medicaid expansion, who have seen providers leaving our state because we do not have Medicaid expansion. We heard from healthcare providers who have seen the benefit and everything that Medicaid expansion can do for people in our communities, you know, how it can ensure that people who are you know, who fall into the Medicaid cliff, that they have access to health insurance, who, you know, otherwise have serious diseases, who wouldn't be able to access medical care or quality medical care would be able to do so under this bill. It would help people who have cancer and who have diseases, who are in rural communities and across the state who don't have access to quality medical care without this. To get the life-saving care that they need. Medicaid is life-saving, and you know, I think we heard a lot of misinformation from opponents when I went back and reviewed it. And I think the benefit seems to be overwhelming, in my opinion, and that it's long past time that we've done this. There are 41 states that have passed Medicaid expansion. We are one of the only states in the country that still has not done it. You know, I know the number is vary year to year, but, you know, we hear 130,000, 150,000 Kansans would gain access to health care through Medicaid expansion. So, you know, I think it's long past time that we did this. I think we had overwhelming support in testimony, and in regard to the motion that is on the table, you know, if there is ongoing debate in this committee, I do think that we should take it to the House floor and let members of the House vote on this. And so if the motion that has been made is the wish of this committee, then I think it is a great way to move this bill forward and make sure that we get a vote on the House floor. So I'm supportive of the motion. Thank you.
Further discussion on the bill. Representative Blacks.
We heard a lot of good discussion yesterday, both pro and con. There was a lot of falsehoods, maybe a few on both sides, but I think I'll be against this motion. I think we need to do our work as committee.
Further discussion, committee. Representative McDonald.
Thank you, Madam Chair. With respect, Representative Blex, I don't see how we can do work on Medicaid expansion in this committee if we can never bring it up. And as the new girl here, the process has been quite frustrating, especially in the minority party. I heard this morning during our agenda that today is the 5-year anniversary of the last time that the House passed Medicaid expansion. I've learned in my short time here that you can't please everyone, and each vote that we take will make some people unhappy. But I think we would all be hard-pressed to find one issue or one policy that we could pass that would enjoy the same enthusiastic support of 70 to 80% of our constituents statewide, regardless of party. Like Lindsay said, 457 people took the time to submit testimony in favor of Medicaid expansion. None of the speakers who came to speak in favor of Medicaid expansion yesterday were paid. And I think that probably the 12 lobbyists and opponents who came, some of those couldn't say that they weren't paid to be here from out of state. I think that the 457 people included doctors, hospitals, long-term care facilities, sheriff's departments, regular people, parents, pediatricians. These are good business decisions. They are fiscally responsible. And I would urge each of you to really think and listen to your constituents and their testimony when you cast these votes, because sometimes change is incremental, but other times we can do big things. And I think it's really past time that we do this important thing for Kansas.
Committee, further discussion, comments on the bill, on the motion? Representative Haswood.
Thank you, Madam Chair. I think a point that comes to my mind was able-bodied, and we hear it a lot in this conversation, though expanding Medicaid would help folks who fall on hard times and find themselves not healthy enough to work. It also helps folks seek medication and to stay in their jobs and to continue to pull them up by their bootstraps. We're not talking about folks who had it easy in life. We're talking about folks who are hourly workers, who are from grocery store clerks that we see on a weekly basis, home health workers. We're talking about those folks here today, and this would be a great opportunity for us to give them some of that health care insurance, and many folks here in this coverage gap. Although this is not the perfect solution, it's not the one solution that's going to save our healthcare system in Kansas, but it's one of the most solutions that will give us the progress that we need to make sure that all Kansans, we continue to strive through the goal of all Kansans living healthily and safely in our state. Thank you.
Committee, further discussion? Representative Reese.
Thank you, Madam Chair. We heard people speak on opponents and proponents, and everybody had a lot to say. But I really was struck by hearing from Western Kansas, from the doctors and those that are hospital administrators, about what this would mean to the rural hospitals and all those providers. We heard, we've gotten testimony from law enforcement, from disability providers, and I just can't see us ignoring all of that. I don't know how we can ignore it. I know in 2018 when I ran for office, I wasn't the only one that had Medicaid expansion on my priority list. I know people on the other side of the aisle had the same thing. They've talked to me, and these are things that we have agreed upon, that Medicaid expansion is important to the state. The majority of the folks in the state are saying that they agree with this. They want Medicaid expansion. We were elected to be the voice of the constituents in our districts, but we are also the voice of constituents in the entire state. We deserve to give them a continued voice by being able to bring this bill to the floor and have a bigger debate and the vote to expand Medicaid. And I think that, the proof is in the pudding, as they say. If we think that it is so unpopular and that we don't have the votes for it, then I say let's prove it. Prove it that we don't have the votes. Prove it that we do have the votes. Either way, we need to bring it to the floor so that the rest of our colleagues have the opportunity to debate and vote on this bill. Thank you, Madam Chair.
Representative Bueller.
Thank you, Madam Chair. I think I'm in alignment with Representative Blacks, and I prefer to let the committee process let that process play out like it has on any other bill that we've heard this year. And I guess I would say if there was a model for Medicaid expansion success in this country, we did not hear it yesterday. There is not one state that you can point to that says this is the model that the rest of the country should follow. They're just not. And so when you look at it, three things are true. The number of enrollees what's projected is going to be grossly understated. The cost is grossly understated, and there will be a contraction to the workforce of 7 to 11%. Those three things affect the economic competitiveness of this state. And when I go back and think of the number one issue when I campaigned 2 years ago, it wasn't Medicaid expansion, it was tax relief. It was the economic condition of this state. And if you look at any other state that has gone down this path, and I'll use Kansas as an example. For every dollar that we take in, roughly 60 cents goes to education, 26 cents goes to entitlements, including Medicaid and everything else. That leaves 14 cents on the dollar for us as legislators to manage the rest of this state. Why would we increase another program that we all heard, you can't unwind it, you can't undo it? When we have 14 cents of discretionary spending for every dollar that we take, why would we jeopardize that? So that would be my point. And I guess the flip side is I am not unsympathetic to this issue. We've talked about ways to reform Medicaid in its current form. That's through hospital reimbursement rate, physician reimbursement rate. We can act there. And the biggest crime would be not taking further action for those 7,500 Kansans who are on the intellectual and developmental disabilities list and the physical disabilities list. Until we fix that and make that a done issue, then I think that needs to be our focus rather than Medicaid expansion. Thank you, Madam Chair.
Representative Orpeza.
Thank you, Madam Chair. And my thoughts, and I would respectfully disagree with the representative who just spoke, Bueller. Thank you for your comments, and I appreciate that. I believe we can do it better here in Kansas. I think we have a good plan here in Kansas. I think the people who have thought about this, and we heard from our Kansas people, our institutions here, will do it better, have learned from past mistakes. Our past being the first is not always the greatest thing to do, but people did do it. We've learned from mistakes, and I think Kansas can definitely do it better. I have complete and absolute faith in those people to make this program work and this expansion work. You brought up the waivers. We did have a motion on the floor. That was voted down. So when we talk about taking people off of wait lists, we had the opportunity to add 500 people, and it was voted down on an amendment. So we're not doing the right thing for the state of Kansas and getting people off of waivers. At least with expansion in Medicaid, we can get coverage for those who unfortunately make minimum wage and need to have preventative health care and need to be addressed and not end up in our ERs as their primary care clinics. This is just something that needs to be done, is the right thing to do, and I keep hearing from constituents constantly that it's just the right thing, and it's the right thing for Kansas, and it's a humane thing to do for the state of Kansas. And I would like to be that voice for the state of Kansas and going forward. And the conferees said explicitly that 83% of small businesses were for Medicaid expansion, which is economic growth, or keeping that growth and not losing what we already have in small businesses here in the state of Kansas. I would like us to see to support what we currently have. So thank you very much, and I would hope that we'd pass this out with no recommendation and give our fellow colleagues on the floor, the rest of us in the House, of the people, a voice and a vote. Thank you.
You know, one thing I'd like to comment, Representative Orpeza, that you mentioned, and you talk about the vote for the additional 500 slots on the IDD waiver. Did you hear the response to why many of us voted no on that from Representative Carpenter? There is not the workforce to handle an additional 500 because we've already opened up 5 slots. And we're trying to meet the needs for those 500 to be covered. There's no way that we could handle 1,000. So if you did 1,000, you've got 500 people out there that it's disingenuous to tell them they're going to get help when we can't even find the workers to provide the services that they need on that waiting list.
So in response to that, Madam Chair, respectfully, when the ranking spoke in regards to making and ensuring that we had the open spots, that when those spots were open, then the workers would come and then that they know that they would have jobs.
Where do they come from, Representative Orpeza? Where does that skilled care come from? Where do they come from? They're not going to just magically show up. They're just not going to. Because those of us that have worked in this area for a whole lot of years and have watched this budget, watched the deal, number one, the IDD waiting list is the one we struggle with the most because it's a very, very complicated list. It's not like the other HCBS waivers that we have out there that are easier for us to take and fulfill because they're not as complicated. And that's why we've been able to eradicate the waiting list on all the other ones. Except that now we're starting to see an increase on our PD. Again, it requires a much more skilled type care. And we don't have the workforce. We don't have the workforce in our hospitals. We don't have them in our clinics. We don't have them in our schools. I don't know why people would think that all of a sudden people are going to come to be able to start serving this population. We're going to struggle to do the 500 that's been recommended in our budget to open up.
I would think that our population and our people who provide those services would provide other services while people are being trained and being able to use those and help those people as they can.
How long does it take to go through training? A year, 2 years, 3 years, 4 years? I can't tell you. So you're going to say we're going to open up 1,000 slots. And I'm not going to sit here and debate this again because we did it on the House floor. I've just always felt it's very disingenuous, and I was on the social services budget for a lot of years, so I know that pretty well. I can't dive right into the numbers today because I have not been on it. But I do know that whenever we would overpromise, they really felt we let them down because we made a promise and we couldn't commit to that. We couldn't fulfill that promise. And that's why myself, I can't speak for my other colleagues, voted that amendment down the other day because I wasn't going to overpromise something I knew that the state could not deliver for those people within the next 12 months, which is what that vote would have done. Further comment, questions on the bill? Representative Barth.
Thank you, Madam Chair and committee. I won't repeat some of the things I've already heard from some of my colleagues here on the committee, so I'll just kind of stick to some of the newer things as well that I wanted to add. I do look at this as Medicaid expansion of being socialized medicine, and that, the United States of America is not a socialist country, and I know we should be learning from the states that actually have done this and have repetitive errors. One of the things I heard was that this eliminates the categories of what is qualified. I look at we're helping the most vulnerable today with what we have available with adults that are disabled, pregnant women and children. And the last thing I want to do is hurt those folks from being able to get the care that they need. I also looked up on page 3, line 13. It has the word hardship. Yesterday after the meeting, I don't know if you guys saw, but we had Secretary Janet Stanek from the Kansas Department of Health and Environment here, and I went up to her and asked her about the definition of a hardship, because there is no definition in this bill. And so there's nothing in me that will allow for us to have something that goes so unclear into what would be qualified. And we're already removing categories. So, I think the numbers that we're looking at would be grossly underestimated of who would actually be qualified, which we've already seen from other states as well, which means we also would have grossly underestimated costs and expenses and numbers that would be astronomical compared to what they were predicting them to be. We also heard from, a state that had more IDD wait lists that just implemented this. So I just think that that is incredibly irresponsible for us to hurt those folks that should have access. So I won't beat a dead horse on that list, but I think that that's extremely important. When I asked the regional hospital system person about the rates, I don't know if you guys noticed it, but I said it wasn't 100% true on how he responded. He gave us a Medicaid reimbursement rate, or Medicaid reimbursement rate. I think he said it was $48. But I asked him about, what would a standard, person come in with regular insurance, like a Blue Cross, United, Cigna, what would the range or cost of that be? And I also asked about, well, what if you're a cash-paying patient, which is somebody who doesn't maybe have insurance, or maybe it's a business owner or something like that. It could be all types of different folks. And he told us, well, it's based off of percentages and their income. Maybe for Medicaid, but not for what I was asking for. It had nothing to do with that. He could not answer the question, which I think is very concerning because there is a definite answer there. I am in the healthcare business and around costs and providing affordable care, and do know there are other ways. We also heard Senator Beverly Gossage came in and spoke about options that we have already today existing that are actually more affordable for Kansans to participate in. And she also explained that the Medicaid expansion, if we actually were to expand it, would keep those folks from being able to get that lower healthcare costs that are available to them today based on the subsidies that are already available, which do not cost the Kansans anything today. And quite honestly, anybody can go onto the exchange, which is called the federal marketplace, and enroll in benefits through that site. And based on your income and things of that nature, will clarify what type of subsidy that you qualify for. I think $0 premium, $0 deductible, $5 copays for a primary care visit is the most affordable thing that I've ever heard of for someone that is in that category, which is available today for our folks who are of lower income. Something else that really concerned me that I think we probably didn't even focus enough on was the fraud that also could exist. So there's a lot of things around that. I also was concerned about taxpayer dollars being used for abortions. I think that a lot of us would not appreciate our tax dollars going to pay for people's abortions if they elect those. And then also just around the private coverage, you know, somebody's got to bear the cost of this. And the bearing of the cost would be we the people across Kansas would have to be responsible for bearing the cost. Employers would get those costs passed on to them as well as their employees, which would really throw even more people probably into that lower income bracket, which is doing the opposite of what we should be doing to help people. So I am not in support of passing this. Thank you.
Committee, is there further discussion, comments? Representative Blacks.
Thank you, Madam Chair, for the second time. Rural hospital issues, pretty dear to me. I guess I was born in the hospital in Independence when it closed, so maybe I have some connection. There's about 102 rural hospitals, and 27 of them in our state are at risk of immediate risk for some closure. And according to the Center for Healthcare Quality and Payment Reform, the primary reason of rural hospitals are at risk of closing is that private insurance plans are paying them less than what it costs to deliver services. Now, are you going to try to make me believe that Medicare reimbursements, which is even lower, if they can't survive on private insurance, then they're certainly not going to be able to survive with a lower rate that's going on if we expand Medicaid and make that payment. So, you know, they've got some good plans because right now hospital is important. We don't want any of them to close, and particularly our rural ones. And they're based on service-based fees, and they have to maintain staff, doctors, nurses, and so on. And there almost needs to be another, like a standby capacity payment to that for the privilege of having those people on staff, because sometimes they have lower volume and their costs are a lot the same. But in every case in this study, it indicated that it wasn't, you know, it was because the payment of private insurance plans is not enough to keep them afloat, even at because of low patient volume. So if we put them in a risk with higher numbers of people that they get lower reimbursement, that ain't going to work well. Thank you.
Committee, is there further discussion or comments? Representative Bryce.
Thank you, Madam Chair. I just had a couple of comments. I would just like to say that I think there's a lot of common ground among everyone who's here, and that we want to help those who are in need and those who are disadvantaged more than us. And it's frustrating maybe for a lot of us to face these issues. I can speak, I think everyone here wants to do what's best for those who can't take care of themselves. I know, just speaking for myself, and I know there's been some discussion of me not currently practicing medicine in Kansas and so forth, but let me just point out, my background is over the last 30, 40 years, I've started inner city healthcare ministries for the poor, carrying my doctor's bag under bridges in Los Angeles, started healthcare ministry for the poor in Dallas area, 2 of them. Started healthcare ministry for the poor in Shreveport, Louisiana when I was medical director of a level 1 trauma center, section of primary care, ambulatory care center that saw over 100,000 people a year, and I saw them falling through the cracks, not having the other things that they needed. My family has spent 30 or 40 years opening medical clinics, feeding programs, schools in the jungles of Haiti. My parents have given their life in the country of Haiti. Please pray for Haiti. They're having a horrible time right now. But I've been there, and I'm not saying this to build myself up, but I'm trying to just explain, no, I haven't been in Kansas my whole life. I have spent that time doing my best to organize people, organize churches, organize Christian ministries to help those who are most in need. So when I heard about Medicaid expansion, my ears perked up. I thought, well, this could be something that could help the poorest of the poor. This might be something that could help children. This could help the disabled. And so I was very interested because of my background, obviously. But when I found that it is for the able-bodied working age adults, it doesn't sign on any children, doesn't sign any the disabled, doesn't sign on any of the poorest of the poor. They're already covered. There's no off-ramp, as the conferee said yesterday. It's the Hotel California. You know, once you're in, you never check out. And I just can't in good conscience vote for something that does not address those who are most in need in our society. It shifts funds away from those. And so, Madam Chairman, my vote's going to be no. Thank you.
Committee, are there further questions or comments on the bill or the motion? I might just add a few. You know, if you think about the Obamacare, and we heard some information from Senator Gossage because she actually sells those policies. Those policies cover at a higher rate than Medicaid does. And according to KHI, about 38,000 people will lose their Obamacare. I don't see more doctors taking Medicaid just because we expand it. We have a lot of doctors that don't take it because of the reimbursement rates. I'm not quite sure the individual referring that doctors were leaving, because I'm not sure why doctors would leave because we don't have Medicaid expansion when we don't have enough doctors to even take Medicaid. I heard nothing except that if we give them insurance, that it will increase and improve their health care. But I didn't see anything in there where it said that there would be education, there would be a process to get them to start going to a doctor on a regular basis, actually utilizing it. I didn't see where it would talk about getting pregnant women out there to get their prenatal care. We do know that we do have some cultures within our state that have poor birth rates, and it's because they don't get prenatal care. So I didn't hear anything that we're going to take and increase them or that we're going to guide them to do that. If you think the waiting list on our HCBS waivers will go away, they won't. I can tell you that when I started looking at, let me see if I can find that. North Carolina. North Carolina has about 14,000 people who receive basically their HCBS IDD waiver. They call it a innovations waiver. 14,000 people. But 17,500 are on their waiting list. So they have more people on their waiting list, and they're an expansion state. Again, reimbursement rates, reimbursement rates. And I did understand, I get the comment from one of our colleagues here about proponents being, or opponents being paid for coming in from out of states. What failed to be said was the proponents and how they orchestrated and told individuals that they didn't have they were not going to be allowed to testify yesterday because somebody wanted to control the debate yesterday on the proponent side. We did hear yesterday able body is a federal designation. We're feeling pretty confident that the work requirement is false because we haven't seen it granted yet. We have safety net clinics. They're called Federal Qualified Health Care in Kansas, and that's for our uninsured, underinsured, and insured if they choose to use one. Some of our communities have more than just an FQHC. They have private organizations out there. I know in Wichita we have the Guadalupe Clinic, which takes only people that have no insurance, zero insurance. And some of their doctors at that clinic are the top doctors in our community. We also have the Hunter Health Clinic that takes if you're insured or uninsured. As we look at reimbursement rates, and I happen to have some here for hospitals, and Representative Blex brought up delivering babies at hospitals. One of the codes that for obstetrics for Kansas pays $779. In Colorado, that's $1,309. In Missouri, that's $1,936. In Nebraska, that's $2,041. And the $47 we heard earlier on one of the codes for emergency room, in Colorado, that's $136 reimbursement, $253 in Missouri, $101 in Nebraska. Our colleagues, Representative Will Carpenter's been involved in it, and I've been talking to him. We've worked on this for the last couple of years, is how do we correct these reimbursement rates? And the goal is to actually get physicians to take Medicaid. Because why would you take a patient if the insurance doesn't even cover your cost? Hospitals still close in Medicaid expansion states. We have hospitals out here, you may hear of a rural hospital that's setting with, say, $2 million. And when we deal with a state budget, $2 million doesn't sound like a lot, but to that hospital, it is a lot. Medicaid may bring to them a couple $100,000. How does that keep them from closing? It doesn't. And it's not just the reimbursement rates, there's other conditions that they deal with as well. I'd rather see us, and this is where I've been stuck on this. I know some people tried to make it about myself and the Speaker of the House and Senator Gossage's private lives on us being involved in the insurance business. I've never sold health insurance, ever. Never licensed to sell it. Well, I was licensed to sell it just because that's the insurance that we had. So my business relationship has nothing to do with my decision on here. My decision is based on we're not taking care of the people that we've already made a commitment to. We're not covering them. We're not getting them the services that they need. When we do that, then we can talk about expanding something. But why would you expand a broken system? I don't understand that. I struggle with that greatly. So that's my comments on it. Are there further comments or questions? Representative Bueller.
Thank you, Madam Chair. Just one more comment. I do think it's my job to be the voice of my constituents. And I have a couple in my district who have a daughter who's been on the IDD list. And by the way, I'm a member of the interim committee on the IDD and PDs. So last summer, when I found out I was on that committee, I was talking to them about their daughter's experience, and ironically, it led to the subject of Medicaid expansion. But for context, their daughter, in June or July of 2013, they got on the wait list for services on that IDD list. They found out in December of last year, 10 and a half years later, that they were finally eligible for those services. And so when I talked to the parents of this girl, who's now 28 years old, I said, what's your opinion about Medicaid expansion? They said it would be the worst thing in the world for us because their daughter would go to the bottom of that list and their wait wouldn't have been 10 and a half years, it would be 12 years or 14 years or maybe never get those services. And so that is a real life story from a constituent in my district, and their experience on that list was 10 and a half years, June or July of 2013 to December of 2023. In good conscience, for them, I cannot support this because that's the reality of what would happen. And that is and I'm their voice today. Thank you, Madam Chair.
Further comments, questions? Were you? No. I'll do Representative Reese, and I'll come back to you, Representative. Go. Representative Haswood.
Thank you, Madam Chair. I just wanted to be on the record and join several of my colleagues who have called for this bill to move to the House floor and give our colleagues a chance, if this bill is so unpopular, to give this a chance to have that vote on the House floor, so not just 17 of us will be able to decide this huge of an issue, that we should put it to the House floor. Thank you.
Representative Reese. Representative McDonald.
Can you remind me of the motion on the floor right now? I'm sorry, with all of this back and forth, and I'm just trying to make sure I know what
Pass out the bill.
Thank you. As it is? Okay, thank you.
Without recommendations.
Perfect. That's what I needed. Thank you.
Further questions or comments? Representative Reese.
Thank you, Madam Chair. There's so many things to Medicaid, and there is a way to provide services to folks who are on waiting lists, even while they are trying to hire staff. Those providers have told me this, so I tend to believe them. I'm not in their buildings to see what's going on, but if they tell us, they've told me that they can get the staff, they need the slots first. So that's the thing with IDD. But the thing that I just don't understand, why people can't understand the fact that there are folks out there who are working. They are working, they're working hard, and they have no benefits. And there's all kinds of circumstances as to why a person might not be able to work a full-time job. And maybe it's only temporary until they, are able to get some skills under the belt and maybe get a full-time job. They're working part-time jobs, they're working 2-3 jobs, and they're not getting the benefits, and who might qualify for this, for Medicaid expansion. And for the moms, I thought that they could only be on Medicaid for 12 months. Then after that, they have to qualify just like everybody else. The children can go on and receive Medicaid, but the mother doesn't. I just think that being able to move this bill on by accepting, approving the no recommendation, it helps to move it on so that we can have even a bigger hearing and allow our colleagues to be able to debate the bill. And we may hear the same things, and that's fine. But then everybody's had the opportunity to do that, and not just our committee. Thank you, Madam Chair.
Representative Reese, I might note that pregnant women are allowed to get on, so that could be 9 months plus 12. Just FYI.
Thank you.
Is there further comment or questions on it? Would you like to move your motion?
I move.
You've heard the motion by Representative Reese to advance House Bill 25, naturally, I don't have it in front of me, 56, excuse me, without recommendation. Is that correct?
Correct.
All those in favor signify by saying aye.
Aye.
Opposed, no.
No.
Division.
Division has been requested. All those in favor say aye, or raise your right hand. 1, 2, 3, 4, 5. Is that correct?
Yes, yes, Madam Chair.
All right. The motion stands because there was only 5 yeses. The bill does not advance.
The folks that vote no, that have to raise their hand.
No, ma'am, they don't. All right. That concludes our business, and as of right now, we have no more meetings. This was our last meeting in order for us to meet, so we'll be working on conference committee work. Oh, if you want your folders that you've had all session, make sure you take them, or the folders will just be recycled somewhere and taken care of, disposed of, so. With that,
Madam Chair, if I may,
Representative Epley?
I have an announcement for the committee to stick. I have an announcement for the committee to stick around for just a minute after everyone's left, just for a brief moment, please. Thank you. Committee members only.
We're adjourned.